and you can open it. Go to the second slide. Okay. So first message for all of us, that diabetes is not a disease, though I mentioned about the sugar sweetened beverages. Diabetes is not a disease because you eat sugars or you don't eat sugars. It's a genetic disease. It comes to us from inheritance of the genes which we borrow from our parents and the forefathers. And although diet will have its importance and physical activity will have tremendous importance, but really speaking, we have to take into consideration the fact that if we are going to get a diabetes, we are going to get it. Maybe sooner, maybe later in life. The challenge is if you can push it to later in life. Because the number of years that you do not live with diabetes, naturally, you do not live with all those complications with diabetes. So it's longevity and it's quality of life, two important aspects, right? So what happens? Our pancreas, which is an organ behind our stomach and the intestine, generates lesser and lesser number of insulin as the years go by. The cells which make insulin degenerate. They don't make any more insulins. If they don't make any more insulins, then our sugar metabolism goes haywire. We are not able to control our blood sugars, and that's how diabetes comes. So if there is someone who has a diabetes, you cannot really only say, look, I am going to keep a good diet and I am going to exercise for a while, but I am going to keep away from medication. That doesn't happen. Everything has its own importance. Everything has its own place. So please do not listen from one patient to another. When someone says, look, you are a diabetic, what are you taking? Insulins, 2 pills, but look at me, I don't take anything. One human system is not equal to another human system. It's not like an automobile car manufactured by Maruti Suzuki. The models can change, but the engines are same by and large. It doesn't work with the human system. We are all different genetically. So when our genes are different, we will live life differently, like the overall character of a human being. So this is important. Insulin getting lesser, manufactured lesser, working also later. It's not working on your system, therefore you get diabetes. This is a chart. You can read their IDF 7th edition Atlas 2015. They just updated this in 2016, this month, and told us there are 93 million people in this country living with diabetes. 93 millions is huge. In 2020, the prediction is, by the IDF, that's just 4 years away, 1 out of 6 Indians above the age of 40 years, 1 out of 6 Indians above the age of 40 years will have diabetes. I don't think there is any disease which is even comparable in terms of the prevalence that is predicted. Right now, it's about 1 in 12, 1 in 10, depending upon the statistics that we generate, but 1 in 6 is huge. So what's going wrong? Why is it that our diabetes is going by leaps and bounds? Because we are going to overtake China. You see, this is where we'll be superior to all other countries. We should be ashamed of it as a country, but that's how it is. The reason why we get it early is called as a thrifty gene. Thrifty gene. Let me explain. When we were students, diabetes was described as type 2. By the way, patients go on asking, do I have a type 2? Do I have a type 1? 95% of all diabetics are type 2. Only 5% are type 1. Of those, 3% are children, 2% are adults. So by and large, every single patient who gets a diabetes will have a type 2 diabetes. What does that mean? It's not that your pancreas are irreversibly destructed since childhood, but as you grow, for some reason, they start functioning lesser and lesser. So what is a thrifty gene? When we were students, diabetes was described, it was called as maturity onset diabetes, manifesting for the first time at the age of 55 years and beyond. Those were our undergraduate textbooks, all of us who read at that time, 55 years. What is the current definition? Maturity onset diabetes, type 2 diabetes mellitus is described in diabetes by and large occurs after the age of 35 years. 20 years of early onset in 20 years of passage of time, 2 decades. The worst, the IDF prediction, and now we have prediction from Chennai, which does a lot of work on diabetes. It is called as the Chennai Urban Population Study, CUPS. 4 years from now, diabetes will manifest at the age of 22 to 25 years. That's extremely scary, right? The gene is becoming thrifty. It's getting manifested earlier and earlier and earlier. Understand? So what does this mean? That in no time, our generation is going to get diabetes very early. So it's not a question of what we can sit together here and do. It's also taking care of our children and their children. That's our moral responsibility also in terms of what we can give them in terms of health. Understand? So before I show you any slides, the question 1, is diabetes a preventable disease? Yes and no. Genes cannot be taken care of. You can't avoid your genes. You can't avoid your parents. So that's it. Bottom line. Let's not have a second thought on that. But then, can you prevent, when you say prevent, delay the onset of diabetes? So if my father is a diabetic, I don't want to get it at an earlier age. I don't want it at 35. I don't want it at 40, 45, 50, 55. The more I push it, the more I am healthy in terms of the way I can live my life. So long back, this is about 15 years back, and this is the most important data that came out. There was a study called as Diabetes Prevention Project, DPP study. What was that study? Some of you who are diabetic or are aware of how to treat diabetes use a medication called metformin. It's very common. It's a very important drug. What does metformin do? Whatever insulins you are left behind in your pancreas, which it generates, that insulin is made more effective, more potent. So use your own insulin in a better way. This study had 3 arms. 1, patients were given a medication called metformin straight away to prevent diabetes or delay the onset of diabetes. 2, patients were asked to exercise daily and recommend a diet schedule daily. Recommend a diet schedule daily. When we say recommend, doctor says, please exercise daily. And don't eat sugar, don't eat potatoes, don't eat rice, a general recommendation. I hope that's understood. And the other, sorry, I'll switch off the phone, it just came off. And the third arm had a recommendation where they were asked for intensive lifestyle modification. What is an intensive lifestyle modification? The doctor supervises daily, or the medical staff supervises daily. Not less than 90 minutes of exercise daily, not less than 90. Aerobic activity, not burning less than 250 calories per day. And a dietitian, like Dr. Schaefer, supervising what you should eat, what you should not eat, right? Every day's diet chart properly. Report every 7th day and tell what you have eaten, how much you exercise, how you exercise. This is called as intensive lifestyle modification. Here are the results. If you take a pill of metformin, diabetes onset is prevented by 3.5 years. If you exercise and use a lifestyle modification, almost similar, 3.5 years to 4 years. If you have an intensive lifestyle modification, regular exercise, on the dot, 90 minutes, diet schedule, diabetes was prevented by 7 years, pushed beyond by 7 years. What a great message this tells you. That diabetes is not a preventable disease, but it is pushable to a large extent. You can push it back and back and back and try and get a more healthy lifestyle. That's an important message. So we have a walkathon. I'm sure you are all aware of it. All of us have registered for it, right? Walkathon. So what is a walkathon? You get up one day in the morning on a Sunday and walk for whatever duration. But you see, walkathon is not one day. It should be a way of life. Your pledge should be not to walk on that particular Sunday, but that's the start of what you want to do every day of your life. And it's important. So, let me have a show of hand. How many of you exercise daily? So very nice. You have to be honest, huh? Daily. How many of you exercise? Not daily, but try and make an effort of exercising as many days a week. And how many of you don't exercise? Saying that it just doesn't by and large matter. So sometimes even doctors are asked. I remember one good diabetologist, and he gave a lot of advice to the patient, what he should do and he should exercise. So the patient said, but doctor, do you exercise? He said, doctor kaun hai aap hai ki main hu? Wo pucho mat kuch. By the way, jokes apart, I do exercise every single day of my life, whatever it is, whatever happens here, there, all across the world, all sorts of turmoils, in and out, but we have to exercise daily. Not that we are always successful. Now, as a doctor, I cannot motivate patients to exercise because that doesn't happen. Sometimes it is difficult for us to motivate ourselves. Half of my family doesn't exercise. Let me be frank to you. But I can't help it. Well, I say it's all up to you because motivation is always self-motivation. It cannot come because a doctor talks to you. So please take it forward from that point onwards. Quick, more slides. When do you diagnose diabetes? How will you know that patient has a diabetes? Two very important criteria. If your fasting sugar morning without having a cup of tea is 125 milligram per deciliter, that's diabetes. Sure and certain. Second, if your 3 months of average sugar, that's called HbA1c, is more than 6.5%, that's diabetes. Now that's a very sensitive test. You really need a good lab. So you must come to labs like at MGM because we have excellent pathology facility. We do quality work. We do it again and again. We have bulk of work coming in. So we try and process our tests again and again. We are sure. If we have doubts, we ask the pathologist. We all have that interaction. So my point is, HbA1c is a sensitive test. Please do it at a good lab because it's a very important test. 6.5% and above. Post-lunch is a little here and there. When you get it above 200, then it's diabetes, sort of. But still, reliability is fasting. Okay? Now, I'm going to tell you what is going to happen. This 125, there are a lot of people who are saying this 125 is too high. Let's lower it to 115. And that's going to be the standard in no time now. So our definitions are going to change. In the next editions of pathology book, we'll have 115 as the cutoff. 150. And or your HbA1c is between 5.6 and 6.5. You already have a red signal. So follow that advice of how you can push it out by 7 years. Intensive lifestyle modification can prevent that 5.7 to go to 6.5, can prevent that 100 going up to 125. That's something which we have to remember as patients. Risk factor is this. But remember, I mean, this is so very important that we look at obesity as this whole focus on this particular week that MGM is celebrating in terms of trying to do the best for patient care. One aspect is trying to tell you that obesity is bad. Yesterday also Sharat Sharma talked to you about it. It's very bad. Now, the truncal obesity, what you have here, is it goes by your trouser size also. So we say that for men, 90 centimeter is okay, your trouser size, waist size when you go to your tailor or wherever you purchase. And for women, typically the trouser size should not exceed 95 centimeter. So very tough, no? So very tough. This obesity is what you see on the outside, but the worry is inside. I talked to you about what is called as the visceral adipose tissue, VAT. VAT is very important, but that's the fat around the intestines. That fat is terrible. It is a marker of heart attacks, it's a marker of blood pressure, marker of strokes in the brain. Everything goes wrong. Therefore, one should try and exercise because you burn off this fat and you burn off the fat inside the stomach. Otherwise, the thrifty gene will come earlier and earlier. If you don't exercise and sit on a computer whole day, your son or daughter is exactly going to do the same. So they will exactly look like this. Generations you will pass on this thing. And therefore, I think the prevention of diabetes starts with prevention of obesity. All these are very known slides, right? Apple and pear, apple and pear. So the children sit on the computer, watch Lionel Messi play, see a Katrina Kaif dance, but they are like this. So that doesn't help. That generation is not going to get better anywhere. Okay. These are some of the risk factors: high cholesterol, high BP, family history of diabetes, and genetics, non-white race. We are not whites, we are Indians, Asian Indians. We always are at a risk, we can't help it. I talked to you about type 1 and diabetes, a word about gestational diabetes in pregnancy when you want to pass it on. Pregnancy creates certain hormones which are secreted by the placenta, which link the baby and the mother. And these placental hormones increase the sugar levels. Typically, they will come when the mother is in the end of the second trimester, 26 to 28 weeks. And the definition of diabetes there is very different. The fasting level cutoff for a pregnant woman to get diabetes is 92 milligram per deciliter, not 125, not 150, no 100, 92. And the post-lunch after taking that 75 gram of glucose is 163. So 92, 163. That's lesser than that is expected in a mother. If it's beyond, then she has a diabetes. And she must take insulin during pregnancy because none of the medications are safe. And this is important. Okay, so what happens in diabetes are three things. Okay, four things, let me tell you. Number one is this is the pancreas. So the pancreas secretes lesser insulin. Second, liver. You have all, of course, heard about this word called fatty liver. What is a fatty liver? When you put on fat on your abdomen and in your skin and everywhere, you can't handle it, so it goes in the liver. It is the first bus stop for whatever you cannot handle. All goes there and gets deposited, and you come with a sonography report of fatty liver. Ask the doctor, give me medicines. He said, what medicines? Go and exercise, man. Get rid of the fat. Everything will go off. This liver is a potential source of generating higher and higher glucose. And what liver generates will come in the fasting blood sugar. Fasting blood sugar is related to your level of exercise and obesity. Post-lunch sugar is related to how much insulin your pancreas is generating or not generating. Have you understood this? And the third mechanism is absorption from the gut, from the intestine. So we have medication to decrease the absorption from the intestine. That's called as voglibose. So you eat a pill, whatever sugar is you are eating will get lesser absorbed. Okay? Symptoms of diabetes. How do you know that you have diabetes? If you have these sort of symptoms, thirsty, hungry, frequent urine, tired, blurred vision, infections, sexual problems, tingling of numbness, wounds that just don't heal, and sudden weight loss. Please understand, not everyone will have all these symptoms. You can have just one symptom, that's enough. The most typical symptom amongst all that I see in clinical practice, very, very common in Indian situation, are two: frequent urination, numbness or tingling of the feet. Very, very common for diabetics that I see in clinical practice, and mostly all over India that is the experience. Wounds may not heal depending upon the vessel supply going to the skin and the wound. So don't go always by that. The patients who say, I get a cut, but it becomes okay, though I have sugars of 300. That should not bother or not bother you. That doesn't decide how you should be treated. That's a diabetes only. Okay? This is the worst. Someone will talk to you from the eye specialty about this. Blurred vision is the worst because if the retina gets affected, there are certain things you have to take care of. Later, they are very difficult. We have probably one of the best dialysis units in New Bombay at MGM. We have excellent kidney facilities in the hospital, good team of nephrologists, and they will tell you these are all diabetic patients, but all are irreversible. You can't help it. It's all gone by that time. Retina of the eyes, if they get affected, that's bad because that's not reversible. Obesity causing osteoarthritis of the knees, ask Sir Dr. J.P. Jain. He will tell you what then you can do. Once it has gone beyond a level of repair, you need to correct it. There's nothing you can do. You need to replace the joints, get it back in order. All right. What is our job in the cardiology faculty is this. One of the biggest issue about diabetes is it will start thickening your blood vessels. The first time your sugars are up, your blood vessels are already thickened. Diabetes has that tendency to thicken the vessel from inside, allow clots to get formed inside. And therefore you see very young diabetics with heart disease, blockages, 1, 2, 3 vessels everywhere, stents here, stent there, bypass surgery at the age of 45 years. You see, this is something which is the hugest worry for all countries, because if you are a diabetic and heart disease comes early, then you have the young generation's productivity that gets lesser. This is very unusual in the Western population, in the white races, but it's very, very common with us that we get all these heart disease complications very early, because diabetes by itself, because of a high incidence, clots the circulation. And it doesn't stay very good even when we put stents. In fact, these days, there is a huge belief that diabetic patients always do better with bypass surgery than with stents. Why? Because the clotting mechanism still you cannot handle even if you put stents. At some point of time, the clotting is going to come back. The other worry is strokes, paralytic attacks. Diabetes causes the same problem in the blood vessels of the going to the brain, thicken it, so you have a high incidence of cerebrovascular strokes. Again, preventable if you can get it down. Now, a very important message which I wanted to give you.